Vasectomies are touted as one of the safest and most effective methods of male contraception. However, patient satisfaction and surgical success is highly dependent on the surgeon's ability, which is directly correlated to their training. We sought to design a simulation platform to bolster current vasectomy training that replicates the anatomy, tissue texture, and procedural steps with the potential to offer proficiency criteria in the form of clinically relevant objective metrics of simulation performance. A hierarchical task analysis was conducted by an expert urologist with an annual vasectomy caseload of over 260 cases. In this analysis, the urologist identified 12 anatomical landmarks, 10 procedural tasks, 38 subtasks, and 9 errors that are encountered in the vasectomy procedure. These points were then converted into fabrication engineering deliverables that provided the scaffolding for the simulation model design. Engineers then utilized the deliverables to design and develop a high-fidelity male urogenital simulation model utilizing previously validated 3D printing and hydrogel molding techniques. Finally, the expert urologist performed a skin-to-skin vasectomy on the initial prototypes to ensure that all the deliverables were met. The results of this fabrication process yielded a hydrogel model that weighs less than 5 pounds, does not require any specialized shipping or storage, and has a material cost of approximately $25. Anatomically, it contains all the necessary components required for the procedure, including a scrotum with skin, fascia, and dartos, spermatic cords, vas deferens, external spermatic sheaths, and the surrounding scrotal tissues. Procedurally, it allows users to perform all 10 key tasks, including the setup, local anesthetic, skin incision, vas incision and fascial clearing, delivery of the vas, dissection of the vas from its fascial sheath, vas ligation, fascial interposition, left and right vasectomy, and closure. Here, we see as a surgeon is able to locate the vas deferens utilizing the three-fingered approach. The hydrogel scrotal skin was specifically formulated to allow the surgeons to feel the spermatic cord and the vas deferens between their fingers. All layers of the scrotum were recreated, including the skin, fascia, and dartos, thus allowing the surgeon to accurately dissect through each tissue layer as in live surgery. Here, the surgeon opts to sharply dissect through the skin rather than using electrocautery. However, the hydrogel nature of the model offers users the ability to use electrocautery at any point throughout their dissection. Care was taken to specifically replicate the tensile properties of the vas deferens as well as the surrounding subcutaneous tissues. Additionally, the hydrogel vas deferens were specifically formulated to be mobile as in a real patient. This mobility adds an extra layer of difficulty and forces the surgeons to have to isolate and stabilize the vas before proceeding. All anatomical structures, such as the spermatic cord, could be palpated in each model, while procedurally irrelevant structures, such as the penis, were omitted to improve the transportability and manufacturing requirements of the model. The hydrogel nature of this model ultimately allows the surgeon to fulgurate, cauterize, and/or tie the vas, completing the full procedure as in live surgery. An additional benefit that comes from the synthetic nature of this model is the ability to perform post-procedural dissections and evaluations. Here, surgeons are able to cut down the model in an educational setting in order to evaluate their performance, identify any errors, and ultimately improve their surgical techniques. In conclusion, we created an affordable, high-fidelity, non-biohazardous hydrogel vasectomy simulation model. Although it is in its early stages, the model provides a risk-free alternative to live training on patients for urology residents that allows them to acquire the essential skills and confidence to perform a vasectomy procedure. Ultimately, we aim to conduct further validation studies to display its effectiveness in augmenting urologic training.